I think I'm very honored to be part of this community. The severe underrepresentation of women in the field of surgery by itself.
Yes.
Plastic surgery comes next.
Yes.
I extremely love to do aesthetic surgery and especially facial aesthetics, that is rhinoplasty, and the body contouring procedures, which is liposuction, a tummy tuck. It could be a Brazilian butt lift, it could be breast surgeries.
In today's social media driven world, there is a huge difference between the expectations, the reality, and also the possibility.
And let me tell you, social media, it has created a large amount of awareness, but at the same time, it has also created a lot of unrealistic goals.
Absolutely.
And unrealistic pictures. There's a lot of AI. I have patients coming and just showing me a reel that I want to become in this particular way. I come from a fraternity where we are part of the Indian Association of Aesthetic Plastic Surgeons, the International Society of Aesthetic Plastic Surgeons. So all those social media images sometimes are all gimmicks. And majority of my patients, they don't all are celebrities. In fact, majority of my patients are real people in the real world. Surgery is not the only solution to help you feel good inside. Your internal self-care is a constant process. People come for liposuction as a weight loss option. This is not a weight loss surgery.
So, say for example, someone wants to opt for a rhinoplasty. They don't really know how exactly they are going to look after the surgery.
Well, let's start by an open conversation like we are doing today.
You get one life, so live it on your terms. Without any fear, without any stigma, chase what you truly want. Joining me today is someone who truly embodies this spirit. Dr. Karishma, a renowned plastic surgeon from Bangalore.
Hi everyone, I'm Dr. Karishma Kagodu, both certified plastic surgeon practicing in Bangalore, and I am with Rupali at the Women Icons of India. I'm extremely humbled. Women Icons of India, I think, is a wonderful community, one of the best ways to uplift all the women. Various professions which are underrepresented, male-dominated professions like plastic surgery, me, myself. I think I'm very honored to be part of this community, and I have seen the work that Rupali is doing on Women Icons of India, and I can see all the lovely women who have been on this show representing different fields of life, and whether it's sports, whether it's medicine, whether it's entrepreneurship. So I'm really glad to be at Women Icons of India, and I hope plastic surgery can be represented well.
Hi, Dr. Karishma. It's such a pleasure to have you on board with Women Icons of India, and we've been chasing to have your dates, and we finally have you here. It's such a pleasure.
I'm so happy to be here. I'm always glad to be in Bombay, coming all the way from Bangalore. Bombay is my birthplace, so I'm extremely humbled that you called me for your podcast, and I'm so happy to be here.
So, Dr. Karishma, given the underrepresentation of women surgeons in the plastic surgery field, what inspired you to opt for plastic surgery as your career? And as this is a vast specialty, what exactly is your specialty?
Well, my inspiration is all about, it started with plastic surgery being the diverse medical specialty that is, and it has such a beautiful blend of science, artistry, and final impact.
Absolutely, yes.
That is one. And then the severe underrepresentation of women in the field of surgery by itself.
Yes.
Plastic surgery comes next.
Yes.
So we all have to become general surgeons, then we become either a neurosurgeon or plastic or a cardiac surgeon.
Okay.
And this gap of large difference and underrepresentation is one of those motivating factors which actually took me. And plastic surgery is so vast in terms of, I call it a head to toe profession.
Yes.
Where we deal with everything from a hair transplant to body aesthetics, facial aesthetics. That is the aesthetic part of it. And then you could do a trauma, injury, birth defects, and also reconstruction. So it is plastic, reconstructive, and aesthetic surgery. So being such a vast medical specialty, underrepresented, I want to close the gap for the women and make sure that we are represented. And I think in the last decade, the number of plastic surgeons are more with women in the country.
Yeah. So what exactly is your specialty in this field?
So I extremely love to do aesthetic surgery, and especially facial aesthetics, that is rhinoplasty, and the body contouring procedures, which is liposuction, a tummy tuck. It could be a Brazilian butt lift. It could be breast surgeries. So all of this, as in when I started my career about 15 years back, and I was mainly a plastic reconstructive surgeon. So I was dealing with trauma-related reconstruction, injury-related, birth deformities like the cleft lip and cleft palate, and also hand injuries, facial-maxillary injuries, as well as burn injuries. And most of our training, we are trained as a plastic surgeon to do this. However, my interest always lies with the aesthetics, and I love aesthetics. I love the creativity. There is something new to create on every single basis. You can transform someone's life with just something small. And I think aesthetic surgery was part of reconstructive surgery. So because even if I'm reconstructing a trauma, I am finally giving an aesthetic result. So we are providing function as well as cosmetics. So my main forte finally came down to aesthetic surgery, and I decided to start my own daycare plastic surgery center in Bangalore 6 years back. And I predominantly now do plastic cosmetic surgery, which involves body contouring, rhinoplasties, breast cosmetic surgeries.
Lovely.
Yes.
So Dr. Karishma, what exactly is plastic surgery, if you can explain for our audience?
So for everyone out there, plastic surgery is a combination of reconstructive and cosmetic surgery, also called as aesthetic surgery. So plastic surgery can encompass everything related to refining in terms of trauma reconstruction. So reconstructing a defect after any injury. Trying to reconstruct birth-related defects, trying to treat burn injuries, hand injuries, fasciomax injuries, and also reconstructing post-cancer. So all of this comes in the realm of plastic reconstructive surgery. But there is an entire subspecialty of cosmetic surgery, which is also part of plastic surgery. So anyone we hear is a cosmetic surgeon would also be and should be a board-certified plastic surgeon also. So we do further specialized training. So during our residency period, because we are in universities, we surgeons are more exposed to the trauma aspect and reconstructive side of plastic surgery. But I went on to do certain fellowships in about 4 to 5 countries and further specialized myself in purely aesthetic surgery because that was my main forte, something I loved. And that is where it got me to being an aesthetic surgery. I've traveled to the UK, to Turkey, to Dubai, to Italy, and I've done my fellowships in certain aspects of aesthetic surgery, and finally that's where we are. So plastic surgery by itself started in 600 BC, if you know, by Shushruta himself. And Shushruta was an Indian, and it's written in all our textbooks. In 600 BC, he reconstructed a cheek and a nose using skin from the forehead. And that is the first reported history of plastic surgery. And it comes from India. So actually plastic surgery is not new to India, but still there's a lot of taboo in India. So the idea today for me is to bring about the medical specialty of plastic surgery to the audience and let them know that it is not a taboo subject. It's everything good for one person, and it's all about refining, redefining, recreating, and reciprocating what one feels.
Absolutely. So true. So, Dr. Karishma, plastic surgery is a significant procedure. It not only is a permanent physical change, but it also is very emotional. So, how do you approach patient consultations? And especially in today's social media driven world, how do you make sure that your patients' expectations are more close to the reality? How do you approach patients?
So, first of all, I believe in total transparency. When a patient walks into my clinic, the first thing I focus on is to try to understand why they want a procedure and for what they want a procedure. So we need to hear them, listen to them for some time, understand the mindset behind which they have come and decided to do a particular procedure. And let me tell you, social media, it has created a large amount of awareness, but at the same time, it has also created a lot of unrealistic goals.
Absolutely.
And unrealistic pictures. There's a
Yes.
lot of AI transformations that we see these days on social
Filters.
media. I have patients coming and just showing me a reel that I want to become in this particular way.
Yeah.
So with all that awareness, we need to talk to the patient and make them understand the actual possibilities. So plastic surgery, yes, there are 100 procedures which can be done. The person has certain goals. They have some expectations.
Yeah.
So we need to give them the pros and cons, understand not just the technicality of the surgery,
Yeah.
but also understand what they should expect out of the surgery.
Absolutely.
So there is a difference between reality, your expectations,
Absolutely.
and the possibilities.
Absolutely. Yes.
So these
True.
three things have to be educated to the patient.
Yeah.
Today's date, what is missing is, yes, a lot of show on social media, people talking about celebrities,
Yeah.
but what's missing is the true education and awareness.
Yes.
I come from a fraternity where we are part of the Indian Association of Aesthetic Plastic Surgeons,
Okay.
the International Society of Aesthetic Plastic Surgeons, and we have a forum, we have websites, and I always try to tell my patients, please go and read authentic information by
Yes.
plastic surgeons
Yes.
for the patient specifically, so they understand truly what they are getting into.
Yeah.
So the focus is that I try to build like a trust sort of a relationship with them. And once a little trust is built, they feel heard, they feel safe. And then once they trust me,
Yeah.
I think it's a smooth sailing journey towards what we need to achieve finally.
Absolutely. And what you said is so true, especially in today's social media driven world. There is a huge difference between the expectations, the reality, and also the possibility.
Yes.
That is so, so true. So, giving that kind of information, making them aware, and spreading that kind of knowledge is very, very important.
Yeah. So imagine if someone tells me I want to look like this AI image.
Yeah.
Yes, there is a lot of AI in plastic surgery these days. There are three-dimensional 3D software systems
Okay.
where patients want to see their before and after images.
Okay.
And to some extent, I think, yes, we can morph
Yeah.
and show them results. But remember, it's the human hands.
Absolutely.
Which we are going to utilize.
Yeah.
It's going to be our surgeon's skill,
Yeah.
which is going to be used to do the procedure. It will never have the 100% perfection of a 3D morphed image or
Yes.
an AI morphed image.
Yes.
So all those social media images sometimes are all gimmicks.
Yeah.
They are not both certified surgeons, and sometimes they're just showing fake images.
Yeah.
So yes, our software systems do give you a good morphing and kind of show you 80 to 90% of what you may look after the procedure. But I think a lot has to do with the patient being educated, then trusting the surgeon,
Yeah.
knowing the credentials of the surgeon, seeing the work of the surgeon itself. So I like to show my own work, the actual before and after images. And every human being is a different person. Every
Absolutely.
individual is different.
It's unique.
So
huh?
I focus my energies in trying to provide the procedure custom tailor-made for that individual.
Yeah.
So it looks as natural for them and it harmonizes with the rest of their features.
Yeah.
Right?
Absolutely. So this brings me to the same point of how we use filters. On every app, every camera
Right.
has filters on
Right.
it, especially the Instagram filters or Snapchat filters. So there is a huge difference. Like you said, the surgeries are going to be done by human hands.
Yes.
So people do have the expectations of having that kind of filter look as well.
Right.
Yeah.
Which is not possible.
Yeah.
So that is what we call unrealistic expectations. So when you walk in for a plastic surgical procedure, whether it's cosmetic surgery or even trauma related, any surgery, plastic surgery, you need to be, besides being as medically fit as possible, you also have to be emotionally stable.
Yes.
And have realistic expectations with a positive attitude. And that is when automatically the outcomes are beautiful for the surgeon and for the patient.
Absolutely. Yeah. So plastic surgery is a very personal choice, and a lot of people don't opt for it and are not open about it due to fear of judgment. So how do you think we can create more awareness for people being okay to opt for doing any kind of changes in their body?
Well, let's start by an open conversation. like we are doing today.
Yeah.
Okay, it's about normalizing it.
Yeah.
Okay, the idea of openly having a conversation about any plastic cosmetic surgery is where we first start off without any judgment.
Yeah.
So that is important. Now, empowerment can come in many forms, and enhancing one's appearance
Yeah.
or trying to redefine one's look. It could be in the form of fitness,
Yeah.
lifestyle, nutrition, or even skincare. We talk about it and it's normal.
Yeah.
So the day we start normalizing plastic surgery like we discuss about any other self-care decision, that's when we will remove the taboo.
Absolutely.
So
Yeah.
my appeal to always I tell people is like, it is a personal choice and a
Absolutely.
personal desire. Allow a person to choose what they want in this lifetime. It could be having a good skincare routine. It could be being completely fit. So whatever form of self-care decision you take, I think even cosmetic surgery can be considered a form of a self-care decision.
Absolutely, I agree. Yeah.
I mean, I totally believe that the only way the stigma is going to go is when we normalize the conversation
Yeah.
and respect the person who, say, decides to undergo these procedures, just the same way that we respect those people taking any other self-care decision.
I believe you have one life, and you absolutely have the right of taking that decision of if you want to make any changes in your face or your body. I think you should go for it.
Yeah, exactly. So it's more like, as I say, it's a personal desire.
Yeah.
When a patient comes to me to do a procedure, I try to make sure, are they doing it for yourself?
Yeah.
One of the
It's
most
not that-
important aspects of plastic surgery is, number one, please choose to do this for yourself.
Yeah.
And majority of my patients, they don't all are celebrities. In
Yeah.
fact, majority of my patients are real people in the real world, an engineering student, an IT professional, moms, entrepreneurs. There are men increasingly choosing plastic surgery, not just women.
Wow.
Okay, so there are men who are looking for a six-pack procedure, trying to remove body contour in form of liposuction,
Yeah.
trying to remove their love handles. Hair transplant has obviously always been around, but men and women today are just normal, real people who come to do plastic surgery.
Absolutely. And the other day when we were discussing, people have this misconception that celebrities opt for such kind of procedures. But you did mention that majority of your patients are moms, majority of your patients are entrepreneurs.
Yes. And as I said, an IT professional,
Yeah.
someone who's running their own business.
Yeah.
And men and women, I would say about 12, 13 years back when I started my practice, I would say it was like a 90-10 ratio
Yes.
of women is to men.
Yeah.
And today I would say it's becoming 70s to 30.
Oh, wow.
So
Yeah.
there are quite
It's crazy.
a young men, not just young, of all age groups. Plastic surgery, according to me, has no age limits. It can be 18 to 80.
Love
You can always decide to look a certain way. And I think it's all about that decision of trying to be a better version of oneself.
yourself.
And
Absolutely.
each individual has that choice that they can make. The other day I have patients who come in from 2-tier and 3-tier cities, and they are looking for certain plastic surgical procedures. It could be cosmetic surgery.
Yeah.
And these surgeries are sometimes emotional for them.
Yeah.
It is not just physical vanity, as people call it.
Yeah.
I think people have this habit of saying if you do cosmetic surgery, you are a vain person,
Yeah.
or you're body shaming others.
Yeah.
And this particular quote of Sushmita Sen, I remember really well in one of her interviews where she said, if you like yourself a certain way,
Yeah.
when you look across the mirror and you love yourself internally, externally, then continue to be happy. And yes, if you decide to make a few changes, which will help you feel a better self-image, help you boost your self-confidence, then go ahead and do it. And don't care about anybody.
Absolutely.
But yes, surgery is not the only solution
Yeah.
to help you feel good inside.
Yeah.
Your internal self-care is a constant process.
Yeah.
And you being happy internally sometimes may not change by getting on a surgery table.
Yes.
So that is also something people should know. Like doing the procedure, you should be very well informed, absolutely be knowledgeable and educated about it, do it for yourself, and be positively motivated about it. And sometimes if you're not happy internally, even the procedure that we do may not make
May
you
not,
happy.
yeah.
So you should be doing it for the right reasons.
Absolutely. And like I said, you have one life. If you like it, go for it.
Absolutely, yes.
Yeah. So, Dr. Karishma, there is a huge misconception, especially when it comes to surgeries going wrong. And I have heard a lot about liposuctions and the rate of deaths involved in the liposuction surgeries. So can you just clarify that and tell us more about it?
So I think this is one of the very common myths. The moment they come for liposuction, the first thing they're worried that I heard about this death and that death in liposuction. But actually, the International Society has done a scientific study on the number of deaths which have happened over the last 10 years.
Okay.
And the complication and death rates are literally less than 1 to 2%.
Okay.
There are more deaths with other general surgical procedures, heart procedures, and neurosurgeon surgery procedures. But liposuction in general is not dangerous. It is safe when done with a board-certified plastic surgeon at the right cosmetic center.
Yeah.
Now, the deaths which you have heard of, and few of them, have been for unforeseen circumstances. And there are a lot of patient-related factors. The weight of the patient. Some of the patients were highly obese and they are not a candidate for liposuction. Remember, a person with a reasonably good BMI, someone who has to go for liposuction. People come for liposuction as a weight loss option. This is not a weight loss surgery. A weight loss surgery is a bariatric surgery. If someone is really obese and very overweight, I suggest to them to do a nutritional lifestyle change or undergo bariatric surgery, lose the weight, and then come for the final body contouring, which is liposuction.
Absolutely.
And I think in the last 10 years, yes, 1 or 2 deaths have been reported. It does not make that procedure a dangerous procedure. We can understand if a death is happening on a single day basis. There are millions of liposuction procedures. In a month, we do 20 to 30 procedures. And in my 15 years, I've had no complications. So they are very bad, unforeseen circumstances. I'm sure no surgeon in the world would want something going wrong with their patient. But at the end of the day, let's take that plastic surgery is like any other major surgery. And there can be a lot of circumstances which is not foreseen. And there can be complications with any surgery. Same way plastic surgery. Me as a plastic surgeon, we are trained to make sure these complications are as least as possible. We take all the safety, precautionary, international standard protocols, especially at my clinic, and we make sure we have a well-backed up anesthesia team, a well-backed up high recovery unit. And when you take all these safety precautions with the latest technology, latest techniques, we make liposuction and any surgery as safe as possible. Complications and few side effects can happen with any surgery. If it happens in plastic surgery, it does not mean it's the end. They may not be life-threatening complications. And I think I will treat a complication if my patient has, like I'm treating my family member. If it was my own family member I'm doing a plastic surgery for, I'll make sure. But at the end of the day, treat the side effect, treat the complication. Everything is treatable. And our job is to send you back home safe with a good result.
Lovely. So, say, for example, someone wants to opt for a rhinoplasty. They don't really know how exactly they are going to look after the surgery. So that is a very big anticipation that everybody has related to plastic surgeries. So how do you deal with that? Do we have any kind of AI-driven apps or any of such systems which are more helpful today and helpful for you and also for the patient?
Absolutely, yes. There are 3D software systems and AI-generated systems which do morph your results and help you understand how you would possibly look after the surgery. Nose is a crucial center part of your face. So being the central feature of the face, there is always the maximum fear and anticipation. Everyone wants to look how that nose is going to suit the rest of the face.
Absolutely.
I hope I don't look like, like a hobbit or something. I've had patients telling me that. So I do have 3D software systems, even for the breast and for body related also, where we can take a picture and there are cameras which take the picture of the patient, and then the software, you can tweak the software and show them how they would approximately look. But I still believe that to some extent the software gives us realistic picture, but it's not 100% realistic.
Exactly.
And I feel a patient should not go with that expectation in for surgery. At the end of the day, AI is not operating on you.
So
It
true.
is the surgeon who is operating on you,
Yeah.
and it is human hands. And sometimes there is a chance that what the software shows you, you may not get 100%.
Yes.
So there's always a margin of 10 to 20%.
Yeah.
And I personally believe that plastic aesthetic surgery, when we do it, I do not perform it chasing perfection.
Correct. Yeah.
Okay? It is not one look suits all.
Yeah.
In 15 years, as many rhinoplasties I have done, every nose is a different nose.
Absolutely.
And this is something I learned from my mentor where I trained in Istanbul.
Yeah.
And he told me after 15 years of doing rhinoplasty, no nose is the same nose.
Yeah.
But I feel the patient should ask the surgeon for their results.
Yeah.
Look at different patients and see what results the surgeon has brought about, their before and after. And the work of the surgeon is something you should see.
Yeah.
Because no matter how many results I show you and the software show you,
Yeah.
when we do the rhinoplasty, it will look different on every different face.
Absolutely. Yeah.
The procedure in general of rhinoplasty, for example, is the same.
Yeah.
The steps are almost the same.
Yeah.
But the same steps in every individual may give a different nose.
Different. Absolutely.
There is different bone structure, the cartilage structure, the
Yes.
skin structure.
Yes.
So I believe you should see the work of the surgeon,
Yeah.
see the credential and the board certification. If the plastic surgeon has done training specifically in that procedure
Yeah.
that you are looking, whether rhinoplasty, body contouring or breast surgeries, and then have a clear, open one-to-one discussion with your plastic surgeon. Ask the surgeon for before and after pictures. I don't think totally relying on AI will give you 100% picture.
Absolutely.
This is how I look.
Absolutely.
I would say it's a 70 to 80% morph,
Yeah.
but the rest depends on the trust that you put in your plastic surgeon.
Absolutely. And I think having realistic expectations of what exactly is possible and what is the best that can be done for you is something that is more important.
I think so, absolutely
Yeah,
too.
yeah. So, Dr. Karishma, what is your message for women of India?
For all the women in India, believe in your strength, believe in your power, and believe in the right to redefine your life. No matter what it is, if it's your career, it's your individuality, it's your gender, it is your appearance. Own it unapologetically and do what you feel is right. Whatever the mind desires, the heart can achieve, and vice versa. For all the women out there, no more you need to be underrepresented. It's all up to you. If you have a voice to speak up and you have something to give to the community, I think all of us as womanhood in general should rise up to the occasion. When I took up surgery, there were hardly any women in this profession, but today I'm thriving as a plastic surgeon. So all the women out there, please do what you feel you want to do, because everyone can achieve it. You just need to have three things: the passion, the perseverance, and some perfection involved.
So, Dr. Karishma, here's your rapid fire round. One myth about plastic surgery.
One myth, there are 100 myths on plastic surgery every day in and day out. But the commonest one is that plastic surgery is only for vain people. Let me tell you, it is more emotional than just physical. And any real person has a personal desire to do what they feel. And all real people do this procedure. It's not just celebrities.
Most bizarre surgery request you have ever received.
Well, I did have someone asking me for elf ears, and I think they were inspired by some movie. In my mind, I was thinking like, listen, let's come to reality. This is not the Middle Earth, but we had to give them the realistic possibilities, which is not possible.
One celebrity transformation you admire.
I think recently it's all about Kris Jenner. I wish I was a surgeon who had brought Kris Jenner to what she is. She's turning 70 right now, and people are comparing her to her daughters. She's looking like she's in her 30s, and she's done, I think, a blepharoplasty and upper eyelid surgery. She's done a beautiful deep plane facelift and neck lift, which has given her a beautiful jawline. And this is where you can see how plastic surgery, if done well, can look so natural. I mean, people are putting her pictures against her daughter. She's looking like she's in her 30s. I mean, that is something amazing. I wish I was a surgeon who had done this procedure.
Ever fixed someone else's botched job?
Well, I would not like to call it a botched job. I would like to call it a rescue surgery. And yes, there are some times that few procedures require touch-ups, and I have redone certain rhinoplasties and certain liposuctions. Yes, I would call it a rescue surgery, and I think the results are amazing when done right.
Do you think everyone secretly wants a better face?
I don't think a better face, but they definitely sometimes want a few tweakments and probably look a better version of themselves. Everyone is beautiful, but yeah, we all sometimes like a few changes.
How often do people come in with a celebrity face and say, make me like this?
Yeah, 90% of the times. But let me tell you, it is not possible to do a copy paste look, right? We have to choose an individual and customer procedure, what makes you look as natural and subtle as possible, because you cannot be a celebrity completely.
What's one thing no one tells you about post-surgery?
That you need to go through an emotional healing, not just physical. So please have patience. Post a surgery, it takes a few weeks for recovery and it doesn't happen overnight. So you need to be emotionally strong and you will do well, eventually see results.
Can surgery really fix low self-esteem?
Absolutely, yes. There are many cosmetic procedures, like especially breast reductions, sometimes rhinoplasty, which really boosts the self-confidence of a person. And the way the person looks in the mirror and smiles, that is when we know the way they walk into a room, the way they dress, that tells us how amazing their confidence has boosted.
Have you ever told someone you don't need this?
Yes, absolutely. According to medical ethics and ethical practice, it is essential for us to let a patient know if a particular procedure is not suited for them or if they have any sort of body dysmorphic disorder for which this procedure may not suit them. So yes, I have said no for a surgery.
How often do you have to remind people this ain't skincare, it's surgery?
Oh, almost every other day. Don't talk about that. When I walk into a room, if I introduce myself as a doctor, I mostly get, are you a cosmetologist? Are you a dermatologist? Well, I am a woman plastic surgeon and we are born with the scalpel, not with serums. We are not resurfacing the skin. I have been in an operating theater all my life in the operating room, restructuring anatomy, not resurfacing the skin. Surgery is a total different specialty from dermatology and cosmetology. We are in the operating room and they are handling the skin.
When you opt for a plastic surgery, normally every surgery will have a follow-up surgery.
Not necessarily all the time. Plastic surgery is permanent. The results are supposed to be permanent. But there are a few procedures, especially rhinoplasty, sometimes liposuction and a breast surgery. There are a few procedures where at times we inform the patient that a revision touch-up procedure may be needed. It will not be a major surgery like stage 1. But revision touch-up procedures can be needed in a few procedures, not all surgeries. And rhinoplasty is something where we see in the future, because the nose that we operate on is a very delicate structure with delicate cartilage and bone structure. Sometimes with age itself, the structure wants to change itself and it convolutes. So the cartilage moves in its own direction. So rhinoplasty is something where I inform all the patients that in the future, there could be age-related changes also which can happen on the nose. And a small revision touch-up procedure may be needed, which is not major.
So, Dr. Karishma, what a lovely conversation we have had. And I'm sure our audience is going to love it as we've created so much of awareness around plastic surgery. Thank you so much for being on board.
Thank you so much for having me on your podcast. And I think it was great to share this information. And I hope it has created some sort of awareness and most likely been educative for the audience which is watching, and some amount of awareness about plastic surgery and women as plastic surgeons. So I'm thankful to you and very grateful for being on your podcast. Thank you so much. Thank you so much. And thank you all for watching.
Thank you.